This is Dr. Bass with the Wilford Hall Cardiology Clinic. And as you know, February is Heart Health Awareness Month. That's right. But heart health is something that spans age, it spans gender, it spans ethnicity, and unfortunately, it still remains as the #1 killer in the United States. Well, as we take on heart health, what we're doing, we're building a team of healthcare professionals to include our nurses, our administrators, and of course, our providers to talk to you about different issues that impact your heart. So today I have with me a friend and a colleague, Dr. Veronneau. He is an expert in the field of cardiology. He's a cardiologist just like me, but he has a specific focus on high blood pressure or hypertension. So I want to introduce to some and present to others Dr. Veronneau. How are you doing today?
I'm doing great. Thank you for having me, Dr. Bass.
Good. Now, why cardiology? Yeah, I know why I got into it, but why did you get into cardiology?
Well, first off, I love the patients, but then also the aspect of cardiology that I love the most is just the blending of different imaging, the heart as well, and then also just how much we know about the heart.
Wow.
Is phenomenal.
Well, great. Well, I mean, a lot of that is similar to you'd think you were in training when I came through. No,
Exactly.
But it's like you said, there's so many different facets of cardiology that make it so interesting to us. Now, I know we're here to talk about a specific disease state, and that's high blood pressure or hypertension. So what is hypertension?
So high blood pressure is a problem with basically the arteries of the body, mainly having too high of a blood pressure that is persistently elevated.
Now, is there a specific number that a patient should be worried about? Or, I know that those numbers change over time. What are they now?
For a diagnosis of hypertension or high blood pressure, essentially it's a top number or a systolic blood pressure of 130, anything higher than that. And then also the diastolic or the bottom blood pressure basically greater than 80.
Wow. Now, I know there's a host of patients of mine coming out of the holidays that have certainly exceeded both that top and bottom number. And I know they ask me this a ton. What are the risks to develop high blood pressure or hypertension?
Essentially, with high blood pressure, when you have that blood pressure higher than those numbers, you start developing an increased risk of basically having strokes is the most common one. Then also heart attacks. You can also have increased risk of basically heart disease and heart failure.
Man, and none of those are things that I think anyone wants, but to understand that hypertension itself is preventable, I would hope, right?
Absolutely. There's many different things that you can do to basically prevent high blood pressure. And with that, a lot of it can come from different risk factors of it, like obesity, basically sleep apnea and untreated. And then, of course, also there's other genetic factors that can factor into basically developing hypertension.
Wow. So there are genetic factors, there are lifestyle factors, there are, like you said, certain other things. Now, I mean, because a lot of folks are a little overweight and don't exercise and don't do those lifestyle things. But now, aren't there certain types of hypertension that can occur at older or younger, even if they don't have, let's say, obesity, diabetes, and those other things?
Of course, and there's lots of different things that can secondarily or contribute to basically secondary causes of hypertension, where in the young you can basically see renal artery stenosis. You can also see other conditions that basically increase the risk of having high blood pressure. In very rare circumstances, you can see very rare things like pheochromocytomas.
Oh, goodness.
Which
that's a lot of doctor work there. But I'm glad to know that, you have to, number one, know that you have high blood pressure. So taking your blood pressure and checking it, I think, is important. Now, I know there are folks out there that are borderline. I always see patients that are a little hypertensive or maybe just there. Now, can they prevent their progression to just true hypertension?
Yes, and by controlling different risk factors, one of the biggest, most controllable one is obviously related to weight. And a lot of Americans are unfortunately in the overweight category, if not obese. And one of the biggest things you can do to prevent progression to blood pressure is controlling weight. Every 3 to 5 pounds that you lose, you can basically see an improvement in your blood pressure by 1 to 2 millimeters of mercury. So that's pretty noticeable. And
wow.
If a lot of times we tell patients that they need to lose about 10% of their body weight. But with that, normally a lot can actually have really good control of their blood pressure. And that's something they can easily do.
Wow. And that doesn't cost anything. Weight loss in and of itself that doesn't have any side effects other than increased energy, less joint pain, better sleep. I mean, those are side effects that I'd pick. But I know that let's say they do those strategies and we want to get them now, we want to prevent stroke and those type things. But aren't there medications also? So what are some medical treatment?
Of course, there's so many different classes of medications, and a lot of them are very well tolerated. But essentially, we can find the right medication for the right patient. And there's some really good data out there that says certain people do benefit from others, while others can benefit the most from others. If you have diabetes, an ACE inhibitor can actually be a great option for you. If you develop a cough with an ACE inhibitor, you can always start on an angiotensin receptor blocker, which is called an ARB for short.
Wow.
But a lot more doctor words.
Yeah.
About that.
I mean, it helps because I know patients are reading and talking to Dr. G, that Dr. Google, to figure out about these medications. Well, Dr. Veronneau, thank you so much for that insight, and I'm sure it's going to help our patients understand about high blood pressure or hypertension. But if you had to say a few things, 3 or 4 key points about hypertension to the patients, what would they be?
First off, check your blood pressure regularly. So essentially, the only way we can know how to control your blood pressure best is essentially if we know that you have high blood pressure. And that means monitoring it regularly. There's lots of different things for a second point that you can do to basically control your blood pressure if it is in fact elevated. Controlling your weight, controlling other risk factors can all do a number on basically reducing your risk of further progression, and even controlling and maybe even getting out of those bad numbers, being like greater than 130 over 80 for your blood pressure. And then also with medications, for my third point, I would say with medications, if we do need them, if lifestyle factors cannot address your blood pressure, then of course there are a host of different medications that we can find to basically control the blood pressure to reduce those risks of some of those diseases processes that we mentioned.
Wow. Well, you've just given us a master class in about 5 to 10 minutes that I know our patients are going to benefit from. Thank you for your expertise, and thank you for your time today, Dr. Veronneau.
Thank you for having me, Dr. Betts.
No problem. Thank you.